Okay, so this is a piece of skin. This is from the face, one of the thickest areas of the face, right in front of the ear. We usually remove this during a facelift. You can see the skin right here. This is the epidermis and the dermis. This is barely 1.5 millimeters, and this is one of the thickest parts of the face. Look at that. This is the ruler. This superficial white layer, that's it, is the epidermis and dermis, and it's barely 2 millimeters. And everything else, this is the fat, and this is the fascia. So when we do microneedling to the skin, we have to stay in the superficial layer. You have to do max 1 millimeter or 1.5 in my opinion, depending on the thickness where you're doing the treatment. Under the eyes is extremely thin. You gotta be very careful. In the lips, you can go a little bit deeper, but the whole field is around 1.5 to 2 millimeters max. Now, this is the microneedling device I like to use. This is set at 0.5. You can barely see the needles coming out. Now, I'm gonna put it at 2 max. You can see that's how it goes. You see how deep it is? So now if you go at deep, I know I'm at the dermis level. I know I'm safe, even if I do the maximum power on this device, so I cannot hurt the patient. And at 0.5, it barely shows. A little bit higher, 0.8, which I like in the cheeks. See, it goes a little bit deeper. And now the needles are going into the skin and initiating a radiofrequency energy that has been scientifically shown to increase collagen and elasticity into the skin. Now, a little bit higher at 1.5, you can see it, you see? And now at 2. It has to be done by expert. You cannot just do 2 under the eyes. It's going to be a problem. You're going to melt that subcutaneous fat and the patient will actually look older. So you got to be careful with these.